Every year, 1.7 million patients acquires infection in hospital, mainly prevent through one simple act: hand hygiene. Hi, I'm Christian Paul Desherdo, your nursing student, and my research tackles about the critical gap in healthcare. Why do nurses, despite their training, sometimes fail to follow hand hygiene protocols? Study shows that 30 to 50% of healthcare workers skip hand hygiene step, putting patient at risk. My project aimed to identify barriers to compliance and test nursing lead training program to improve adherence. Why does matter? Because clean hygiene saves lives, and as a future nurse, we must lead examples. In conducting a mixed method study at 150 med hospital over 8 weeks, I observed 35 nurses across shifts using the host 5 moments or hand hygiene checklist. I also surveyed nurses to uncover like the pressure, skin irritation, or forgetfulness. Then I designed 2 weeks training program with interactive workshops, feedback sessions, and visual reminders. Post training, I evaluate the compliance and compared infection rates in their patients' cohorts. Data analysis including quantitative stats and thematic coding service response. The results were eye-opening. Pre-training, only 58% of nurses followed all hygiene steps. Post-training compliance jumps to 85% and 27% improvement. Patient infection in their care dropped by 22%, particularly urinary tract surgical site infection. But surveys revealed deeper insights. 65% cited rush workflows as the main barrier, while 30% mentioned dry skin from sanitizer. One nurse shared, the training made me realize my action directly impact my patients. This is just about the soap and sanitizer. It's about culture. Nurses are overworked, but small changes like visual cues, peer accountability can transform healthcare habits. My findings aligned with CDC's call for ongoing educations in healthcare settings. For future research, I propose expanding the program ICU and pediatric units. When infection risks were higher in nursing students, we must advocate for systematic support. Imagine a hospital where every nurse hands are first line of defense. Together, we can make the reality cross. So, for me, hand hygiene isn't just a protocol, it's a promise to protect. Let's honor that promise, one clean hand at a time. And that's all. Thank you.